you will have a lot of problems in terms of the disease that they cause. And the other important thing that you will see, I'm not going to talk about that, is that diabetic problems. So those people who are diabetic, they may have increased risk of fungal infections. So you have, when you look at diabetic foot, you will see one of the reasons is that you may have a fungal infection. So they show higher level of fungal infection in terms of as compared to other patients. So again, the key term is invasiveness, and as you can see in the picture, the diabetic patients are very prone to this because their whole electrolyte balance is messed up. And if it goes into your brain, any fungal infection that goes into the brain, it's like, you must have heard about like a flesh-eating bacteria. So they talk about flesh-eating bacteria like the news. So this is like a fungi, which is a flesh-eating fungi, and it kind of chews up, just like your athlete's foot. If you look at it, you know, it's going to chew up your skin, and it's painful. So exactly the same case goes into the deeper part. So what we, once we unfortunately find out that the person has a cerebral zygomycosis, then the chances are very slim in terms of treatment. But again, as I said earlier, you can do amputation, we call surgical debridement. But if it goes for the upper limb, eyes, nose, and they do go for debridement, they do extensive debridement. That's a sad story. And the treatment of choice again is amphotericin B. And as I said, that surgical debridement, immune reconstitution, if we find out there's a deficiency of immune cells. Okay, and that's not simple. I mean, it says over here, we are working on some immune drugs, but so far we have not reached to that level that is going to help us. Any questions thus far? And I think the last of this series of this one, what do you call it? Yeah.
So you said antibiotic use can make somebody prone to fungal infection?
Yes. Yeah. Overzealous use of antibiotics is going to increase the chances of fungal infection.
Why is that?
Why is so? Because I told you, if you look at, one of the reasons is that if you look at the normal commensals, if you remove the normal commensals, they're also normal commensals, they're overgrown. So one of the reasons that these opportunistic bacteria or viruses, you're not even talking about viruses, so they will outgrow in number. So once they outgrow in number, they get more opportunity to invade and cause problems. This is one of the reasons. So opportunistic may also have systemic mycosis. It's pretty much the same, but a little bit of difference in terms of the diseases clinically that we put in this category. And I think I'll check up at the end of the lecture with the current -7, -8 people what exactly they are teaching, but over years we have picked up at least 3 systemic fungi infection. You know, one is blastomyces, coccidioides, and histoplasma capsulatum. Histoplasma capsulatum for sure has a higher incidence, and these are the normal 3 important that you ever see a systemic infection, like bloodstream infection, BSI. So these are the 3 reports that you normally see. And then again, as a pharmacist, I'm pretty sure that if you're going to do the drug sensitivity, you're going to see these 3 important structures. So if you look at their shapes, so you can see the idea for this particular group is that you can see on the top, say, saprobic phase, which is 25 degrees C, as compared to parasitic phase, which is 37 degrees C. So this is environmental, and this is human. So if you go at in the environment, you can see they are there. When we inhale them, they are in a different form. So this is called dimorphism in terms of fungal infection. So that's another issue in terms of the treatment that we normally give to this patient. And if you look at the overall picture for deep mycosis, you can see the deep mycosis on the right hand side. So they can go into brain, lungs, heart, spleen, liver, and kidneys. And these are the routes of entry. So nasal sinuses, blood vessels, esophagus, and then again they can also come through superficial as well. So the idea is that mostly is inhalation, right? And when it goes into nasal sinuses, you pretty much, one of the most common, I think when I was at Loyola, so they merged the allergy department with ear, nose, and throat department. The reason was that one of the commonest things that we will see is nasal issues, sinusitis, in terms of allergy. So allergies usually present because you also pick up allergens from the atmosphere and you breathe them in. Asthma, rhinitis, eyes, so these are the very common problems that we normally see. So this is a good slide for you to kind of have a visual for that. And these are some other things that you can see from here on the right hand side, that there is, if you can inhale the spores, and the spores will go into the lungs, and then they go into the different life cycle and get absorbed. So you can see a typical kind of, life cycle of this particular systemic infections. The other concept is that they are showing, in this case, for example, this is the data that I was mentioning. For example, let's say eastern part of the US, so you can see eastern part of US, well, I would say eastern is the Midwest as well, all the way middle of Iowa, you can see from here. Blastomyces and Histoplasma capsulatum is very common. So that's what I'm saying, that you will always see that particular fungus in this part of the world as compared to the rest of the world. You can see, for all practical purposes we can see, but Histoplasma capsulatum very common in this half of the US population. So you will see a lot of it. So this is the life cycle, a broader picture of the life cycle that you will see all the way from spores, absorption. So this is like a circle that then the fungal infections go through. It's like a complete cycle that they go through. There are some, I think, it should be in the book as well. These are some mnemonics that people have made, right? Depending upon how, you kind of go and process. We used to kind of have one of the things that we used to teach, not me, but somebody else, was to how to collect the clinical sample and how to process it, right? And you can see these are nice charts, especially when you can see from here how do they process sputum, how they process blood and spinal fluid, vaginal secretions, right? Hair, skin, nails, tissue. So the kind of a visual overall picture, a master slide, if you want to find out how we process a clinical sample for fungal infections. Rest of the slides are more, I make it for myself, but those of you who want to read, and I just picked up for my mnemonic. So you can see from here birds, right? You can see bird droppings. It goes inhaled by the guy who's running, right? He picks it up into the immune system. The cells fight, phagocytes which absorb it and then put it into the whole systemic system. So this is called pathogenesis slide. So pathogenesis for the bird dropping fungi. So that's one way of getting fungal infection. The other way again is we talk about the gardeners. So you can see again digging in soil, aerosols, you inhale it, goes to the lungs, they complete the cycle, and then they can go all the way from skin to bone. Right, so these are again some of the visuals. But as I iterated in the first lecture, what is the therapeutic problem? This is the therapeutic problem. The repeat slide, these fungi are eukaryotic, so they are biochemically similar to human host. It is difficult to develop chemotherapeutic agent that will destroy the pathogenic fungi and not harm the patient. That's an issue. And the rest of the slides, I think, are there for you to look at. The different charts are available. I mean, they're put together, and I think I just copied it from the book. That if you want to put them all together in terms of what are the diseases that you're going to see, what is the causative organism, what is where are they coming from, how is the morphology and clinical manifestations. So these are some of the tables and charts I just picked up from your book, which are there in terms of cramming the material in terms of understanding. And I think the rest of the slides are for your reading only, pretty much details that are already covered. And let me see if there's something you can see from here. It's pretty much all these things which are there for memorization. And there was one important thing that I want to discuss with you. Let me see, the review. Did anybody open up those PDF reviews on the Moodle or not? No. Okay. Well, let me give you an idea, because these are what you call learning material, study guides, so to speak. Let's see if I can open. How do I open it? Struggle with that. When I open this, it doesn't show over here. This is only, that's what the issue with the connection, right?
Yeah, you would have. I couldn't find that.
Yeah, this is screen sharing. I thought this would be something like screen sharing. I have no idea. What you can't even do from here, right? Can you do from here? No, it doesn't work like that. Okay, so I have to open up the PowerPoints that it shows. That's the only way it's going to communicate, right? Not the screen. So if I do like this, let me see if it works. No. Oh, Blakely, she's an expert on that, right? I don't know she's our computer geek. using that? Color? Did it use that? Maybe Michael. See, there's something that I need to know. I don't know. I thought you did it. Let me see if he's there, because you have 10 minutes. You can try it. And I'll see Dr. Karan if you can help me. I did all this stuff, yeah. Yes, so I did all that stuff, but I think this one was, so this, let's see, let me show you what I want. Yeah, this is what I want.
Showing.
What did you do?
So this F8 button.
F8.
Like that.
Okay, got you. Thank you, sir. You see? Somebody has to remember that. F8 button. I thought it was simple, but I thought you guys told me last time. Some of you told me. Anyway. Okay. So this is one of these, actually it is from the book. And you can see like a bird's eye view of many things. You know, so cutaneous, subcutaneous, and systemic. So you have like a visual picture of that. And then it highlights the most important things which are there. I mean, that's my learning style. So I see it many times, I draw it many times, and then go from there. So this is what it is, and then you can see even for the ones in the bottom is say opportunistic. So for me, this is the master slide that I put everything together, and then want to make sure that you can differentiate. Because many a time when the examiner writes the question, he's going to look at the bigger, broader picture of all it. So that's one thing that you may want to spend your time on. And let me see if I can go back to the other one, microbiology review. This one. Oh, well, I don't know how to fix that now. So these are also some of the tables that are there in terms of the notes. And, is one of my favorites. And you can see from here like mnemonics. So they have some of mnemonics over here. And these are some of the drugs that are usually named, the mechanism of actions. Same on the side, you can see those of you who want to make a flashcards, I've got tons of flashcards, but again, it's difficult, I don't want to overburden you with all these things. But anyway, this is something that you want to look at in terms of, I put it up over there for those of you interested. And then finally, I'm going to quickly run through, I don't want you to pay much attention. The DAS7 antifungal that Dr. Kasmia and myself made, that you will probably do in P3. So you get an idea that where it's going to take you to, right? And that's where the drugs will come. But I'll just quickly run through so you have an idea that he expects, and Dr. Gentry as well, both of them will expect you to work it. Let me see if I can find it. No, that's not even another person. You still, okay, you're there. Okay, lectures, antifungal agents. Yeah, so you can see, this is one of the lectures for antifungal agents. They're going to teach you the terminology of the fungi, classification of the fungi. They expect you to know that. You can see right hand side with all this jargon that you have to remember on the right hand side. So this is like antifungal drug lecture from day 7. And then the classes, this is, I did mention a little bit of that azole, but this is where you have to remember antifungal drugs. And I did talk a little bit of it in this one. And then again, you have to know the structure of the fungi because they're going to talk about the detailed structure. Remember, I just briefly mentioned aldosterol with cholesterol, but they would want you to go deep because you have to look for the drugs. So pharmacology of the drug, the drugs themselves, you know, that's not. And then again, mechanism of antifungal resistance is going to be deeper. And then again, all these drugs. So these are the drugs for your memorization in terms of amphotericin B. I just mentioned amphotericin B, told you is an oral. And then again, toxicities, azole group, blah, blah, blah. You know, all these drugs that we talked about in detail that you have to remember the doses from them, azole resistant, you know, oral, the names. So this is pretty extensive in terms of what is expected for you in terms of the drugs and the monitoring, blah, 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 blah. Anyway, I don't want to overburden you that, but you can see this is, so what we tried to cover in this 4 lectures was just to give you the basis and the issues with that. And one thing that I shared with her, let me share that just for one of the recap lecture that I wanted her to show is again as these are some of the terminology things that we talked about. So she just plays it up for my lectures and then you know go with that. So mycorrhizal fungi are, I mean, is hard. I mean, I myself find it hard because we're not used to the terms and we're not used to the names of the bacteria, and people kind of struggle with that. But again, this is up to you to figure out. Dr. Betty Wu was before Dr. Sama. She was working with you. She actually went to industry, and so she talked about invasive fungal infections, a little bit of detail. So I told her what I've told you. And I shared my lectures, and then she's going to go for all these. Pretty much the same thing that you can see. Some of them go with a little bit more details in terms of the terms that I mentioned about. Yeah. So Candida was a big deal, as you can see Candida. Big deal, candidiasis, you know, different types of. So she goes for usually a clinical vulvovaginal candidiasis, a clinical picture of that. Teaches you about the vaginal discharge. I don't want to go in that direction in this case. You know, all the causes of the oropharyngeal candida, esophageal candida, invasive candidiasis, so on and so forth. Anyway, any questions? So what my expectation is that pretty much what is there in the lectures. And if you want to listen to me again, you can see I pretty much repeat myself in the YouTube lectures. And the tables and all these things are available. You just have to have raw concepts and get used to the names of it, get used to the kind of overall picture I showed it to you, get some mnemonics. So you pretty much are ready when in DAS 7 and 8 they go to the drugs. I mean, that's totally. What I try to, I just kind of refer to them, azoles and amphotericin B and things of that nature, and a little bit of clinical significance of that, what is common in terms of, and as a matter of fact, I mean, if I have 5 minutes, I can show with that movie, if that's still a possibility with this. What was it? Zygomycosis? Sorry. is, let's say ABC, right? And now I'm not gonna find it. Oh, I think it was Chicago, right? Oh, it's here. So you can see, if you read the news, you see Illinois 150 cases of deadly fungal disease, rapidly spreading fungal infection in 28 states. So, you know, the fungal infection are serious. I think this was it. So I'm just going to play for 5 minutes, whether you have to leave, and then you can read it on your own.
Owensboro, Kentucky, a quiet rural neighborhood and home to Mark Tatum, a husband, a father, and a grandfather. Mark's story is one of amazing medical advancements and the triumph of the human spirit over what can only be called the unimaginable. Mark and Nancy were married in 1991. Mark had 2 sons from a previous marriage. For 10 years, theirs was a happy home.
We just bought this house, and we were working on remodeling it, and we really enjoyed being in the country and being by the lakes.
But just before Valentine's Day 2000, their so-called normal life would take a tragic turn. Mark went to sleep one night complaining of a common malady, a headache. By morning, it had become unbearable. Mark's wife, Nancy, rushed him to a local hospital, where his condition rapidly deteriorated. A call was made to the University of Louisville Hospital, where Dr. Jeffrey Bumpus assessed the situation.
He had the clinical appearance of having what's called mucormycosis, which is a very devastating fungal infection that kills the tissue and can spread very rapidly. In fact, it can even spread to the central nervous system and brain area if left alone. It can become fatal within about a 48-hour time frame. This type of fungal infection is rare. It's in some